Hello, the topic today is what are the things that can trigger acid reflux or GERD or GERD, gastroesophageal reflux disease. So, everybody, once in a lifetime, they will have acid reflux. But when the acid reflux is so severe, it needs treatment. So, what are the things can trigger the acid reflux? That is the video today. So, first and foremost, the treatment for acid reflux 99% is lifestyle modifications. The same way, the things that can trigger mostly can be divided mostly into lifestyle, diet, and medicines. So, lifestyle. So, what are the lifestyle that can trigger the acid reflux? So, acid reflux is your lower esophageal, the food pipe sphincter is very relaxed, so acid is coming up. So, when they have a obesity, weight, that is the first and foremost in this recent times. Obesity is one of the first reason with sedentary lifestyle. So, no exercise and obesity is a triggering factor for acid reflux. Number one. Number two, suppose they take a late night food and heavy meal in the night time and oily or calorie rich or fatty meal the night time because of the late night work, the lifestyle. People go to sleep very late, so they take food very late. So this is first and foremost reasons for acid reflux. So there should be a gap of at least 3 hours. So for your dinner and lying flat, or any food and lying flat, that should be 3 hours gap. And if you're obese, then it all the more the time, better the results. The other thing is, living alone, staying alone for work reason, or the stress part. Either it could be anxiety, it could be fear, it could be depression. They can trigger the whole thing. The and very importantly, doing sometimes doing the people they don't get time, so they do exercise the night time after taking food. They do exercise, especially weightlifting, squatting. All these things can trigger the acid reflux. The same way, the dress. Suppose they wear a very tight dress, so to get a shape, most of the people now start wearing a corset kind of belt or a corset. So that can trigger the acid reflux. The or tight pants, they can trigger the acid reflux. So when it comes to acid reflux disease, the 99% of the treatment depends upon the lifestyle. The next is the diet part. When it comes to diet, again the same, the quantity and quality. Huge meal, a large meal, especially in the night time, late meal, or oily food, cheese, mayonnaise, ghee, all these things can trigger the acid reflux. The same way, tea, coffee, milk. Tea is tannic acid, caffeine is a potent gastric irritant, and the milk when it goes in, it adds up to the acid, and that becomes like a curd like thing, so that can trigger the acid reflux. Then very importantly, smoking and alcohol. Strictly no smoking and alcohol. And citrus food like mango, orange, grapes, these are citrus groups, they can trigger. Or even a spicy meal, even a deep fry, anything deep fry can trigger. So what we eat is simple steam cooked or boiled food, and at least 3 hours gap between food and lying flat. The other things are all mostly the medications. So certain medications we cannot avoid, we have to take it for lifelong, like diabetes medications, thyroid medications, uh, the steroids for some people, rheumatoid arthritis, for them they we have to take steroid. They all can trigger the acid reflux. The same way, painkillers, NSAID, ibuprofen, or diclofenac, these things can cause acid reflux more. The same way, other medications like for cancer, or these they can, asthma, psychiatric medicines, they can trigger the acid reflux. So if you have a reflux disease, or GERD or GERD or gastroesophageal reflux disease, consult your doctor. He can help you with how to get. They'll ask for certain tests to look for what is the root cause, like endoscopy. But when it comes to treatment, 99% is your lifestyle, and the rest is by your medications. Thank you.